What's up, y'all? It's your favorite nurse and CPR instructor, Lex with the Flex. Listen, guys, I have a news story today, and this one definitely hits just a little bit different. Take a look at this clip.
Dealing with this Alzheimer's thing?
I could live with it in a sense.
Do you fear losing your memories? Is that hard?
I'm sure as it advances, and things going to be different and changing.
It happens. That's what
So the legendary actor Danny Glover, the man many of us have grown up with, watching movies like The Color Purple, Lethal Weapon, Angels in the Outfield, and many, many more, today he has announced that he is living with Alzheimer's. The 79-year-old actor has revealed he was diagnosed several years ago, not long after receiving his honorary humanitarian Oscar. He shared that he noticed changes in his speech, his movement, and his memory, but he says he's continuing to live life with purpose and is grateful for the support of his family. He's also made it clear that he wants to tell his own story his way instead of allowing rumors or speculation to do so about him. So now let's talk about the disease itself. This disease affects millions of families every single year. Now, Alzheimer's disease is the most common cause of dementia. Dementia isn't just one specific disease, it's a general term of problems with memory, thinking, and the ability to perform everyday activities. So with Alzheimer's disease, abnormal proteins build up inside the brain, and over time, brain cells become more damaged and they eventually die. As more brain cells are affected, the brain gradually shrinks, making it harder for a person to remember, to communicate, to problem solve, and even eventually they won't be able to recognize their loved ones. So many people believe that Alzheimer's disease, or some people call it old-timers disease, that this disease is just about forgetting where you left your keys. But it's much more than that. Early symptoms may include forgetting recent conversations, asking the same questions repeatedly, misplacing everyday items, difficulty planning or managing finances, trouble finding the right words, becoming confused about dates and familiar places. So as the disease progresses, people may begin wondering, becoming suspicious of family members, and they may have significant personality changes, and sometimes they lose the ability to communicate and eventually require around-the-clock care. But one thing that I want everybody to understand is getting older, because they do call it old-timers disease. Getting older does not automatically mean you're going to get Alzheimer's. So while age is the biggest risk factor, Alzheimer's is a disease, not a normal part of the aging process. So researchers believe that the disease develops from a combination of age, genetics, lifestyle, and environmental factors. Conditions like high blood pressure, diabetes, high cholesterol, obesity, smoking, and lack of physical activity can increase the risk over time. So here is something else that many people may not know. There are currently more than 7 million Americans living with Alzheimer's disease, and that number is expected to grow as our population ages. Black Americans are also diagnosed with Alzheimer's and other dementias at significantly higher rates than white Americans, making awareness and early screening especially important. So can Alzheimer's be cured? Well, right now the answer is no. There is currently not a cure for Alzheimer's disease. However, newer medications can help slow cognitive decline for some people in early stages of the disease. Early diagnoses also allow patients and families to prepare financially, legally, and emotionally, while treatment options may be more. So as a nurse, I want to give you a few practical tips. If you notice that a loved one is getting lost driving familiar routes, repeating the same story over and over and over, forgetting medications, having trouble paying bills, becoming unusually withdrawn or confused, don't automatically assume that they're just getting older. Encourage them to see their healthcare provider. Early evaluation can make a huge difference. So right now, I would like to recognize Danny Glover for doing something that really takes a lot of courage. Being a public figure and sharing a diagnosis like this can't be easy. By speaking openly, he's helping reduce the stigma around Alzheimer's disease and reminding families that they are not alone. So, if someone in your family has Alzheimer's disease, remember this. They may forget names, they may forget birthdays, they may even forget your face, but they still deserve dignity, patience, compassion, and love every single day. So as we continue to pray for Danny Glover, his family, and every family member that is walking through this journey, I want to leave you with 5 things that everybody should know about Alzheimer's disease. So number 1 is memory loss isn't always Alzheimer's disease. Stress, depression, vitamin deficiencies, thyroid disorders, medication side effects, and even infections can cause memory problems. That's why it's important to get evaluated instead of just assuming the worst. So, there is no cure yet, but there are treatments that may help some people in the early stages slow down the progression of the symptoms. The earlier someone is diagnosed, the more options that they have. Number 3, exercise your brain just like you exercise your body. Reading, learning new skills, puzzles, socializing, and staying physically active may all help support long-term brain health. Number 4, and this is really important, coming from a caregiver. Caregivers need care too. Looking after someone with Alzheimer's can be physically and emotionally exhausting. If you're caring for a loved one, don't feel guilty about asking for help. You can't pour from an empty cup. And number 5, never argue with someone who has Alzheimer's about what they can and cannot remember. Instead of correcting them every time, meet them where they are. What feels like reality to them is very real. And compassion often works better than confrontation. So, as a nurse, I've taken care of patients with dementia as well as Alzheimer's. One thing that I've learned is this: the disease may slowly steal memories, but kindness still gets through. So make sure that you're talking to them with a calm voice, a gentle touch, a familiar song, and a smile. Those things can still make someone's day. So if you have someone in your family, parents, grandparents, aunts, uncles, or even an older neighbor, check on them. Have a conversation with them. Listen to their stories. Take the pictures, record the videos, ask them about their childhood. One day, those memories may become priceless, not just for them, but for you too. So Danny Glover has spent decades entertaining us and inspiring audiences all around the world. Now let's honor him by learning about the disease that he is helping bring attention to. Remember, knowledge saves lives, early detection changes lives, and compassion changes everything. So if this video has taught you something, make sure that you hit the like button, make sure that you share it with somebody, parents, grandparents, whoever that you feel like they can benefit from this video. And for more healthcare news, holla at your girl. This is Lex with the Flex. I'll see you next video.